Hi everyone, for my presentation, I'm focusing on music therapy as one of the non-invasive pain relief techniques and an approved treatment that helps with many different types of disorders. How effective is music therapy? Studies have shown that post-operative pain is reduced by 50% using music. Through listening and playing music, as well as songwriting and singing, pain among patients is reduced. Music therapy can help to reduce stress and anxiety for the patient, resulting in physiological changes including improved respiration, lower blood pressure, improved cardiac output, reduced heart rate, and relaxed muscle tension. The music therapy protocol is designed to perform several functions: to direct attention away from pain or anxiety, distracting the listener with comforting music, to provide a musical stimulus for rhythmic breathing, to offer a rhythmic structure for systematic release of body tension, to cue positive visual imagery, to condition a deep relaxation response, to change mood, and to focus on positive thoughts and feelings, and to celebrate life. Studies have shown that music has been part of the treatment of Parkinson's disease. Parkinson's disease, as we all have learned before, is a disorder that affects the nervous system in the older adults. Parkinson's disease causes unintended or uncontrollable movements such as shaking, stiffness, and difficulty with balance and coordination. Symptoms usually begin gradually and worsen over time. Music therapy utilizes rhythm, movement, voice, and creativity to try to improve Parkinson's disease symptoms. One technique is known as the rhythmic auditory cueing, in which rhythm is used to facilitate movement and improve gait. People with Parkinson's disease often note that moving or walking to a rhythm helps improve their movement. Here is a video from Norton Healthcare and their music therapy program for patients with Parkinson's disease.
Music therapy is the use of music to achieve a non-musical goal. So for this Parkinson's group, we're focusing on using music to strengthen breath support and voice strength, and as well as fine and gross motor movements. So you'll see the stretching and the tapping to the rhythms and playing different rhythms. With Parkinson's disease, it's almost like a person has lost some of their internal rhythm, and so things stop moving the way that they used to in kind of a rhythmic pattern. So using music, like listening to music with a steady beat, playing music with a steady beat, and practicing all of those things, we're hoping to kind of compensate for that loss. And a lot of research has shown that music can help the brain rewire itself around parts of the brain that are damaged. So that's one of the reasons why music therapy works.
Music therapy has additional benefits, including providing avenues for socialization, working with others to perform a dance or a song, offers the opportunity for socialization and collaboration.
And so they've kind of formed their own social network. Usually they don't want to leave once the group has ended because they want to visit with each other. I encourage them to come early, and if they want to stay late, they can.
The nursing intervention for music therapy includes performing a functional assessment of fine and gross motor skills. This helps determine the best way for patient to enjoy music. Plan will be based on the patient's functional abilities, medical conditions, and time of day when music therapy would be most appropriate. Patients will also have regular meetings with a music therapist, meeting 2 or 3 days a week. And lastly, the music is scheduled around the patient's preferences. And that's the end of my presentation. Thank you all for listening.